Unit 1, Assignment 1.1, Multicultural Counseling Video Discussion Posting. Question number 1. Describe the role of communication in counseling and the implications of the differences between the client's and counselor's cultural and worldview. The role of communication in counseling is the only true way to develop a relationship with the client. As cited by Hayes and Erford, page 15, 2018 states, clients communicate their self-concept, emotions, perspectives, and realities, both verbally and non-verbally. Through communication, relationships are built, trust is established, and understanding and empathy are expressed. As a counselor, we are working to develop this relationship and want a client to have a safe place to express their thoughts and ideas. As cited by Hayes and Erford, page 16, 2018, Freud refers to psychoanalysis as the talking cure. And for this reason, language differences between the counselor and client create tremendous challenges. In fact, more than 60.6 million people in the United States speak a language other than English at home. Power is embedded in language. With counselors understanding that language is power, we must work to make sure that clients feel comfortable and meet them in a common place. As a counselor, using traditional methods as cited by Hayes and Erford, page 16 through 17, such as metaphors from the client's culture, encouraging the client to use the language which they feel most comfortable expressing themselves, and using nonverbal behavior is essential to the counseling process. Approximately 85% of nonverbal communication, approximately 85% of communication is nonverbal. As a counselor, developing the client's openness is the goal. Cited by Hayes and Erford, page 19, 2018, counselors should engage in a self-reflective process to evaluate how the counselor inadvertently communicates personal biases, values, and assumptions to a client. A counselor's response should be based on the client's frame of reference. Question number 2. Describe the cultural identity and its relationship to the counseling process. Cultural identity is reflected by the client-counselor interaction. Cultural identity has been defined by Hayes and Erford, cited in Hayes and Erford, page 37, 2018. As saying it shares interactions and experiences as well as worldviews and beliefs. It can also contribute to psychological well-being and resilience. And in some cases, it serves as a protective factor against communicable challenges, discrimination, and historical loss. It may be a particular concern for counselors working with clients who do not share the counselor's racial, cultural, or ethnic heritage. As cited in the communication theory from the Cultural Identity Theory website, cultural is the values, beliefs, thinking patterns, and behaviors that are learned and shared that are characteristics of a group of people. Identity is a definition of oneself. There is a complex relationship between cultural and identity. The complex relationship is what counselors must focus on. When using Hill's model of racial identity development can affect this by having counselors reflect on their cultural identity development and the manner in which associated information processing strategies affect valuable beliefs, worldviews, and interaction with clients, as cited by Hayes and Erford, page 43, 2018. Research on cultural identity as cited by the Communication Theory website states cultural identity is negotiated, co-created, and reinforced in communication with others we socially interact. Forming a cultural identity involves making choices about the culture one identifies with and deciding to join the cultural community to which one belongs. Every individual belongs to a numerous overlapping and non-overlapping cultural and subcultural group. Understanding the cultural identity of a client can give insight on how a counselor should approach a client and how the client possibly sees themselves.